In a previous video, I talked about the so-called Big Beautiful Bill that reshaped how nursing homes operate and how, instead of increasing quality, it drove up administrative burden and corporate control while care staff continue to dwindle. But there's another layer to the staffing crisis no one wants to admit: immigration policy. Under this new administration, key visa programs that once allowed foreign-born workers to fill critical roles in healthcare, especially in long-term care, were quietly restricted or allowed to expire. That includes programs like the H-1C for nurses and reductions in employment-based visas and refugee admissions that historically helped staff these roles. For many facilities, immigrant workers weren't supplemental, they were essential. Immigrants make up nearly a quarter of the direct care workforce in the United States. In some regions, they are the majority. They're the ones helping residents bathe, eat, transfer safely, and manage chronic conditions. These aren't jobs people are lining up for domestically. They're hard, often underpaid, and carry little prestige, yet they're foundational to elder care. So when immigration slows, the impact hits fast. The Big Beautiful Bill added pressure on facilities to meet unrealistic standards without increasing reimbursement or even addressing the workforce supply. But at the same time, restrictions on legal immigration made it nearly impossible to fill vacant positions. That's not a coincidence. It's a compounding problem. Staffing shortages got worse. Facilities were forced to close units. Remaining staff burnt out or left entirely. Residents got less attention, more errors occurred, and families were left with no good options. This is the correlation no one is naming. Restrictive immigration policy plus punitive regulation equals a long-term care system in collapse. If we are serious about protecting our elders, we have to stop treating immigrant workers like an afterthought. They are the system, and until policy reflects that reality, these crises will keep multiplying.